I am going to share my screen and ask if you all can see that.
Yes.
Okay,
Yeah.
fantastic. Well,
Can you turn
thank
it
you
off?
all for being here and taking the time. I know everybody is busy. And
It's still in there, honey. I'm
I'll
pretty
just,
sure.
can I ask if everybody would mute themselves, if you don't mind, just because I get easily distracted.
Yeah.
Thank you. So yeah, to kind of ground us all, I appreciate y'all being here, and I can very much empathize with all of y'all's perspectives. As Len stated, I'm born and raised in Garrett County, in Mountain Lake Park, and I moved away when I was 20. But it is still home. I still have family there, and a lot of roots. So I'm just absolutely thrilled and elated and really proud to be able to be here with you all today. I will also proceed my conversation with saying that I know sometimes when I get going, I can talk very, very quickly. So if ever I am talking too fast or you want me to stop, slow down, go over back something, I don't mind being interrupted. I talk about this kind of stuff, what I'm going to share with y'all a lot, and I get very passionate and very energized by it, and that can come across in my conversation. So yeah, Smart Start of Transylvania County. So our organization was established as a part of the North Carolina's broader Smart Start initiative that started in the early 90s. And our organization, the one in Smart Start Transylvania County, was formed in 1996, 1997, I believe. This came from a statewide push to really improve school readiness and to strengthen community support for young children and families. It was launched underneath the leadership of Governor Jim Hunt, kind of with the idea of tailoring early childhood services and local needs with community-based partnership built in. And so that for us formed our organization. And so we kind of act as I think of us as like the connective tissue in a muscle joint, right? Bringing together public, private, faith-based, other nonprofit stakeholders, and community advocates to coordinate resources and expand access to high-quality early care and education, as well as conversations about what quality means and what those early care options can be and need to be given our unique community standpoint. And so yeah, we partner with lots of different folks within our community, as well as the region in Western North Carolina. It's a large region, but we share a lot of really similar strengths and challenges. And so I will say the unique thing about our organization in Transylvania County is that we really are always working from an understanding that supporting the adults in a child's life, and that's all the adults, right? Caregivers, parents, grandparents, kinship providers, as well as the educators that they're spending time with, if that's in a more formal setting, is really essential so that the children can grow and thrive and learn in a nurturing and emotionally responsive environment. So we have our hands in a lot of different things, and I'm going to try to give a somewhat high-level overview of them today, because I want to make sure we have time for questions. And so some of our different programming and initiatives are in kind of these general areas that support kind of center-based, this is typically licensed or license exempt childcare, the educator retention and support, also a focus on family health and well-being, infancy development, as well as family friend and neighbor, or FFN as we call it, care. So for educator support, one of the programs that we have funded, I've been with the organization over 6 years, that we have funded for as long as I've been with us, and then prior, so I think it's been about 10 years, is a program called Wages. And this is a program that is directly admined by early years. And this program, Wages, is essentially a financial support supplement pay for teachers who are earning low wages. And so within the last year, we had 16 childcare workers that were able to access these funds. These funds we pool from some of our Smart Start dollars, which are our state allocated dollars. So these are North Carolina taxpayer dollars going right back into the early childhood system. And wages is only available to education professionals who are working in a licensed facility. And so we recognize that in our county, since we have such a limited amount of licensed childcare providers and spaces, and we have a huge amount of part-day faith-based centers. So we, using private dollars from one of our private funders, created a program similar to wages called the Prosperity Project. And so this supports educators with wage supplement checks. It's a check that they receive one time a year, and it goes out in May. So we're getting ready to send out, I think, our third year of prosperity checks. And so we just recognize that recruitment and retention of staff in these spaces specifically can be really difficult because a lot of times directors or centers aren't able to provide full-time hours, or they don't qualify for things like wages, as well as they're oftentimes unable to offer any sort of benefits to their employees. And so we modeled this on a tiered system. So we take into factor everything from the amount of hours a teacher works, their education, how many years they've been. And I think the tier system runs between, so the smallest check that somebody would get at the end of a year is $300, and it goes all the way up to $1,000. So it just really depends, again, on the individual's kind of background, and then their where they've been with the organization or their childcare center. Another one of our pilot programs that we created in order to really hone in on early educator quality and retaining folks with kind of a different modality other than just specific compensation. And so it's this program called Pathways, and this is one of a two-part of this program. So the Pathways program, we provide direct cash bonuses to anyone who is employed at a local childcare center and taking early childhood education courses at our local community college. And so it doesn't matter if it's an early childhood education specific course, because we know that a lot of general ed courses are necessary in order to receive even an associate's in early ed. So as long as they're working towards some other accreditation or degree within the early childhood, we give them a stipend based on that. And so last fall, we had 11 early educators who took advantage of that program. A couple of those providers are some of our teacher assistants in our NC pre-K program, which is in our public school systems. And so some of those teachers are kind of staying, which is great because it ends up keeping them in not only the NC pre-K classrooms, but it's also helping them kind of up their education as well as deepen their experience and knowledge level. And then the other piece of this is this Pathways mentorship program, which we were hearing that there was just kind of a big disconnect between some of the childcare providers that were coming into the sector, whether they had education or not, juxtaposed against folks that had been in the centers for a while. And so we kind of decided that rather than paying an outsider, an external consultant to come in, what better way than to really empower these educators? So we essentially cover the cost of the substitutes to come into the classrooms, and it connects new teachers with a more practiced or seasoned teacher to receive some one-on-one mentorship time. It helps educators improve their overall instruction and practice. And some of our childcare programs that participated in this last school year, they reported that not only did it really help nurture and grow teachers individually on both ends of the mentor and mentee, but it strengthened the education staff as a collective team, which is a really great takeaway. We also, again, we always are going to approach childhood well-being and education from a really holistic standpoint. And so we think it's really important to make sure that we're including all families that have young children. And for us in Transylvania County, we developed an unhoused young child or an unhoused family kind of initiative where It's really still in definitely a pilot state where we're kind of figuring out what's working, what's not working. And most often we're helping connect families with access to community resources, providing them with direct item needs and emergent needs that support early childhood health and development. And so this is everything from clothes, school supplies, gas cards, food gift cards for Instacart, as well as formula. We also help connect them to and can arrange transportation. Transportation's a really big challenge in Transylvania County. If they need to get to another referral or resource within the county and they don't have access to transportation. And something that we did this last year, which we're now going to be doing it annually, and it's kind of a bridge together that brings together a handful of our different program areas. So it's our unhoused families, our Get Set Babies, which I'll talk about in a moment, and then our Family Friend and Neighbor Network is this free dental services bus. And so we were able to offer dental care free of charge to anybody that is an early childhood educator, including unlicensed family friend and neighbor providers, or is residing in a home with 0 to 5. And so we also see a lot of multi-generational homes because the cost of living in Transylvania County is really, really high. And so we were able to kind of bridge together a few different programmatic areas, all through partnership with Baptist on Mission, who we got connected to after Hurricane Helene. They were really strong on the ground during that time. And then our local First Baptist Church lent kind of the space and all of the services we were able to render, from the dentists and the dental nurses and practitioners, was free of charge. And that's another element, is that in our county, Transylvania County has really high rates of early childhood tooth decay. Our oral health outcomes are not great within the county. And as well, most of the dentists within the county they stopped a handful of years ago accepting Medicare. So it's very challenging to get, I think, especially pediatric dental health within our county without having to go either to Henderson or Buncombe County. We also are big champions of literacy as a part of school readiness. We have been the local affiliate for Dolly Parton's Imagination Library for over 10 years, as well as Reach Out and Read, which is a pediatric kind of quote prescription for reading that children can participate in when we partner with our local pediatric offices. And so over the last year, about 700 children received books through Dolly. That partnership started as kind of a part of the Smart Start fabric at a statewide level. I know not all states have Imagination Library expanded in there, and I'm not totally sure about Maryland. And then another initiative that we fund with our private dollars is Jumpstart to Kindergarten. And so this is a multi-day kind of half-day summer camp, if you will, that allows rising kindergartners to go to their new to be elementary schools, to meet their elementary teachers, to meet some of their classmates, see where they're going to be. It also really, we find, is really helpful for cultivating a really strong relationship between childcare, or the families and the parents of rising kindergartners, as well as the students and then the teachers themselves. So kind of allows an additional place and space for kind of more intimate conversations to go on. We also recognize that there's a lot of different dynamics coming in for rising kindergartners. Some children that have been in more formal settings since infancy, some that have never been in any sort of childcare setting outside of their home. So it's a program that we've been running. I think this coming year is going to be year 8 or 9. And it's really, really well loved. It's community, or we have some local small funders that fund this repeatedly, which we always can count on, which is great. And maternal child health. This is one that we created, again, modeled after a program called Family Connects. That while it's an amazing program, we just could not stomach funding it, essentially, for an affiliate fund for something like Family Connects. It was like it's $10,000 annually just to be an affiliate, and that doesn't cover the costs of the personnel that comes to run it. And so we decided to kind of adopt, our Smart Start mentality of like, okay, well, how do we make this work for us in our community on the ground? And so it's the same program manager, Chelsea, that operates our Family Friend and Neighbor Network. She also manages the Get Set Babies program. And so this is, again, a program that is not as much financial support and intervention as it is community connection, resource connection. We cover the costs of things like lactation consultants, doulas. We cover the costs of postpartum mental health needs. We also cover, I think just with one of our most recent participants, we covered the cost of some pelvic floor physical therapy for her. We also cover chiropractic care. So it's really kind of coming in, meeting with the families. And these are also, we've had some adoptive and foster families too that are bringing home an infant for the first time. And so we take this especially to heart because we know that the age group of 0 to 2 tends to be a more underserved childcare group in at least North Carolina, and we especially amidst the vast childcare desert landscape that we face, the infancy landscape is extremely dire, and we also do not have a birthing center within our county. Our local regional hospital closed it about I think like 12 or 15 years ago. And while we do have a few midwives and doulas, again, those tend to come, only really, there's not a real equitable access to those services. And so families have to drive to either Hendersonville, where I live, which can be anywhere from a half an hour to an hour away, or to Jackson County or to Buncombe County, which is typically where they send families, which is in Asheville, which can be upwards of an hour away. And so this is a program that it kind of, it all runs on referrals, but the outcomes and the outputs from it are really beneficial. And I think most notably what I'm going to talk about is our Family Friend and Neighbor Care. This is definitely, I think probably if you Google anything about childcare, this is usually what comes up for us. And this was born out of recognizing that, like, okay, we know what the numbers are in our county, but we know that we have X amount of children age 0 to 5, and we know we only have this small amount that are actually in childcare centers. Like, how can we really meaningfully help make a difference for this number of children that we know are there, but we're not really accessing? And we a lot of times would get access to certain families by way of referrals or connection through social services and Head Start, but we knew that there was this huge other population. And so we also recognize that in just the state of North Carolina alone, I think it's about 64% of children age 0 to 5 are in a family friend and neighbor care setting. And it's much more typical in rural areas. And even reflecting on my childhood, I was raised by FFN providers from the Amish and Mennonite community, interestingly enough, which was really rich and amazing. And so I have a great connection to it. We really recognize that just because children are not in a more formal childcare setting, it does not mean that they should not have access to the same types of resources, again, going back to this idea of quality, as well as those people caring for those children. We should be emboldening them to recognize that they are having a really significant and sincere role in childhood education and development for the children that they're caring for. So this started about 4 years ago. We had 13 caregivers initially. It literally came from posting up at the library during story time hours, or posting up at one of the local breweries. And if we saw somebody with a young child, we're like, hey, is this your child? Are you caring for them? Let's talk about if you're providing care unpaid for a family member or a neighbor. And so it started with 13 providers. And it fluctuates between 60 and 73 providers at any given time, depending on children's aging out, because once they turn 5, kind of age out of the program onto kindergarten, and roughly 180 children ages 0 to 5 within our FFN Care network. This network has again grown completely grassroots and organically. We fund it through private dollars that we receive from a handful of regional as well as national funders. Homegrown Childcare is an amazing resource for license exempt, home-based, trusted caregiver providers, and they kind of gave us the seed money to really get started. And really the funds go completely towards the providers. Again, we offer a financial component. It's a monthly stipend that we get, that we give the providers, and they complete a monthly kind of roadmap of activities, if you will. We have really great relationships with our local library, Parks and Rec department, as well as there's a community space called the Family Place, and it operates as essentially kind of a mini indoor and outdoor playground, but also just a community meeting space. So there's a kitchen. You can go there to meet up with other parents or caregivers. They have on-site childcare providers there. So when we hold our monthly meetups for our FFN providers, we cover the cost of childcare at the Family Place, while our FFN providers are then able to be in a totally different room, kind of like a big conference room. We provide refreshments, and they can either just have time to connect, hold conversation together. We bring in guest speakers. We bring in everybody from the extension department, talk about, how to bring gardening into your kind of caring for the kids that you're caring for. We bring in folks to talk about financial literacy from one of our local self-help credit union, which is one of our local financial institutions. We provide also for all of our providers annually in our FFN network, we cover CPR and first aid for everybody. We also cover the cost of ongoing education for any of them that want to seek self-paced courses through, it's called the Southwestern Child Development Commission. And those are all courses that other ECE providers access and utilize to get their continuing education credits and units. So really we take this model of like, okay, let's empower and help these providers, recognize that what they're doing is really important, give them some financial compensation because that really means something. And really we've seen the most impactful thing that we hear repeatedly is that it's not even really the financial component. It's really that community and feeling validated, feeling seen and appreciated, I think is really meaningful. We also pay for, with private dollars, to cover the use of an app. It's called Playground. Brightwheel is another early childhood tech platform that's great, that we use for a few other things. But we pay to give them access to that because, one, it gives a different kind of, just a different level of professionalism than just having like a closed Facebook group, excuse me. And then we're also able to use that. It's kind of a private chat for them. It's very secure and safe. And then we also use that for a lot of our data collection and data tracking. And then I'll say the last thing about our work with Homegrown and the FFN group is because of this amazing partnership and sustained relationship with Homegrown, they came back to us within the last year to essentially build off of the network that we have to now be a pilot with this program called the Thriving Providers Project. And so for the next 18 months, we are giving guaranteed cash income payments to 30 Thriving Provider Project participants. They're all grandparents that are delivering family, friend, and neighbor care to their grandchildren, as well as sometimes some other small children in their kind of care network. But essentially testing what happens when you give FFN providers $600 cash for 18 months. What happens? What happens to the providers? What happens to the children? What are they using it for? FFN care is pretty not well liked or received, I guess I'll say, for a lack of better words, in the state of North Carolina. There's some really harsh policy or laws essentially in place that are harmful, and it's all based around, I think, in my perspective, really antiquated and just systemic issues at looking at home-based or unlicensed or license-exempt care. And so when a lot of childcare providers who are FFN providers hear that, it's a felony in the state of North Carolina to care for more than 2 children that aren't related to you, and that really kind of, for the economy really wants FFN providers to essentially become licensed, right? And it's like, well, if you're going to kind of introduce the conversation with scare tactics, it 9 times out of 10 does not end very positively for recruiting folks into their childcare space. And so we at Smart Start Transylvania County, part of our work with Homegrown is this policy and advocacy piece, right? And so something that we're working on really hard right now is like how to frame conversations to not only our local lawmakers, but our state ones too, about why it's really important to include license exempt, home-based, trusted caregiver providers in the subsidy, essentially, child care development funds, because a lot of these folks are not, either they've left the workforce in order to care for their grandchildren or their friends' children, or they've significantly reduced their hours, they've lost healthcare coverage, and obviously we all know the price of everything is $100,000 just to get out of bed in the morning, it seems. So that was a ton of information. I'm going to stop sharing my screen. Like I said, I talk fast and it's a lot of content. So I just want to say that, like, at the heart of all of this, like, on the one hand, while the Smart Start Network does have the backing of this North Carolina Partnership for Children and the Smart Start Network, right? What is beautiful about it is that it really does enable and empower each partnership at its core to really be responsive to local needs. And I will also say that our state allocation is a complete drop in the bucket compared to what our annual budget is. And so we've been able to really kind of continue to nurture the relationships with local funders, as well as some regional ones, and, like I mentioned, a few national ones, to continue getting repetitive funding to sustain some of these programs. And, you know, I think as well, we have, because we are a really small county in comparison, and have some really small towns, tight-knit community members, there's a lot of investment, I think, from that perspective of people wanting to show up for their neighbors, right, and to help take care of things, and recognizing that, like, okay, if we want something done, we just have to do it ourselves. And so we have a lot of really solid, strong connections with some of our, not only our social service offices, and some in our Head Start classrooms, our NC pre-K classrooms, but all of our childcare providers. There's a lot of retirees within our community that have come and moved to Transylvania County or Western North Carolina in general, to kind of set up shop as a second home, or to just retire here, and they want to get involved in numerous ways. And so that's kind of where we're at. So I will stop talking now.
Thank you for all that. Brilliant. I was going to ask that question about the percentage of your income that comes from North Carolina. So do you know that?
Yeah, I do. So the last fiscal year, our state allocation was about roughly $300,000. And so I apologize, it's telling me my network is not great, so I'm sorry if I'm cutting out. And so the way the Smart Start Network works is that 70% of your state allocated Smart Start funds have to go towards early childhood education specific programming. And so the way we work it is so that we essentially, because we're such a small staff and don't want to do tons and tons of data tracking, so we essentially earmark our money at the state level, and then 110,000 of that goes directly to Health and Human Services to cover subsidy for our county. So we contribute to the subsidy funds for Transylvania County. And then the other portion, which I think last year was like 53,000 and some change, goes to early years at the state level for the wages program, which then, so those are kind of so we allocate the money for them, but it never passes through us. And then we receive trickle down about I think 200 some thousand for direct on the ground program administration and outreach. And so put against our full budget, though, annually, our full budget, including our Smart Start dollars, is roughly 1.2 million. And it's been that amount for the past few years. And so again, this really comes back to diversifying our funds, not only in the sense of like where the funds are coming from and the amount of funds, but also being very mindful of like, okay, we know that our more smaller local funders, like our Episcopal church women, perfect example. We know we can count on about $3,000 to $5,000 from them every year, and they're going to pay that out quarterly. However, then we know that we have these bigger programs that require more, kind of larger amounts of capital to run. And we need those amounts either, biannually or upfront. And so we look at more long-term multi-year grants. And so we're looking at like 150,000, so 50,000 each year for 3 years. Or we received one, and we're in the middle of it right now through Dogwood Health Trust, which is a really amazing funder here in Western North Carolina. And they funded us $550,000 over 5 years. So every year we're getting 110,000. And while they recognize that it was initially grounded in this application and these outcomes, it's obviously going to change dependent on all of the things that can come into all the factors, right, that can affect change. And so that's, I think, another space is like pursuing not only, immediate funds for a year, because that's something too, is like if you get those funds, by the time if you don't have everything like crystallized and ready to like hit the ground running, you hit 6 months and then you're like, oh gosh, we have to spend all this money in 6 months. And so the multi-year funding has been really instrumental to our success, I think.
Awesome.
Yeah.
So what other questions do people have after hearing that?
So
Thinking
Chris,
about Yeah, go.
Tracy. So that was interesting to listen to. Now, I have one question and then, a couple of comments. How many actual childcare slots are you providing with the funds you just talked about, that 1.2 million?
So we are not like a direct service provider. So we do not directly operate any childcare systems. We do offer support and resources and whatnot, kind of as that intermediary. Mm-hmm. So we have, for full day licensed childcare centers, I should know this off the top of my head, I think we have there are, including our 2 Hillview Head Starts, which are run by WNC Source. So we have 4 full day licensed centers. We have 8 part day license exempt faith-based centers that are 9 to noon. And then the NC pre-K classrooms, those are 4 classrooms at 21 children. I cannot do math like this in my head.
I think it's okay. I think it was more like getting towards, or any of those dollars going directly to provide childcare services. And so just kind of, bringing this group of folks from Garrett County kind of together with some of the things you've talked about that I've related to things that are or were happening in Maryland. So you talk about, the incentives, for where they land, credential and years wise. We used to have a program in Maryland called the Maryland Childcare Credential. That has ended. Child care scholarship, so our child care development fund subsidies are frozen. So it really does go back to a lot of that private, money that can come in and support those things. And, how in Garrett County is that built and then sustained, and you still have that, you've got to have the providers, so from a Head Start and early Head Start perspective, we do that at Community Action, and partner with the Judy Center, who does some of the things you talked about. We have the collaborative classrooms, so it's interesting to hear. I think the one piece we've not explored in Garrett County is the Friends, Family, and Neighbor, that program, but still get the root of the problem, the need, and then having those child cares. Is that system enough to really stir up this child care centers, the home providers, that we need to do that care, especially for the children not eligible for Head Start services. So thank you. It was interesting. And, I just had that question and, kind of wanted to tie some of the Maryland things that we've had back to that. So thank you.
Yeah. And I will say that the FFN, because that's the thing too, is like at the end of the day, it's such a challenge, because it's like, I was on a call with somebody the other day and they're like, well, so if you had endless amounts of childcare, like sites and centers and teachers, right? Like, do you think that people, like, you'd be able to fill all of them? I was like, I don't know, because FFN care, like, it goes back to this idea of like prioritizing parental choice, right? And it goes to that conversation about like quality means something different to everybody. And so I think that it's really important not to necessarily like keep everybody siloed. And it's like, well, all of these are valid options. And like, what do we need to do to, and they're all going to exist. They've all been existing for some time, but we also know that like the childcare landscape is becoming more and more strained. And if we, at the end of the day, really want to see children, healthy, cared for, connected to resources, all the things, right? Then it's like meeting those families where they are. And I think that's the thing too, is that like on a nationwide level, like FFN care, whether we call it that or not, is the most widely utilized form of childcare, and I think it typically tends to be so more often in rural landscapes because the deserts are more exasperated. Transportation is a challenge, and a handful of other factors. And so I think that I think at least for us in North Carolina, that's something that if we can continue to really push, again, I think again a lot of this falls into an advocacy standpoint and sector, because policies are what drive the money and how things kind of unfold. And so I think it's important from like an advocacy standpoint to continue to talk to folks about like what is not working and why it's not working, and like here is something that we could try. And I think that's an important piece of this too, is that we've done lots of things that have not worked, and and that has been a teaching moment. And I think too, we really try to prioritize as much as possible, whether it's with our centers and our licensed providers, our pre-K classrooms, or our FFN providers. Like, we center them in those conversations and decision making. Like, we're never going to be like, okay, here, let's go apply for this grant and say we're going to do this. I think it really starts with being like having folks involved in those conversations from the beginning of like, what do you need? And because that's the thing too, is we could offer all the training and professional development till the end of the day, but if nobody can,
parents
if there's nobody additionally to come into the classroom and work, then nobody can take the courses, and so it doesn't matter. And so I think that's something too.
Yeah.
Absolutely. I think definitely thinking outside that box with family and friend, especially in the rural community, you understand that it's hard. The care that's needed isn't always 6 a.m. to 6 p.m.
Exactly.
It's staffing outside of that when there's maybe 2 kids that need that care, not 6 that you can, afford the staff. And then the parents paying, is an issue. Sometimes it's the parents working, the job until 10 at a restaurant. They can't afford that. So, definitely, I think we relate a lot in just that understanding that traditional childcare is not always the answer to what you're seeing on surveys and questions. And that's not, maybe that's what it comes out as, but it's not just your normal 6 to 6 parent pay or Head Start programming. Exactly. All right. Thank you.
Yeah, exactly.
Other questions?
I'm going to have more naive questions. Hi, it's Jeremy again.
Hi.
So, for advocates of childcare in Garrett County, we recognize the challenge, right? It's a childcare desert, right? Comprehensive and reliable childcare is a workforce issue, right? We're seeing it in the places that folks go to work. And it's an economic development issue, right?
Yes.
Like, if folks can't feel like they can bring their kids to Garrett County, they will not come to Garrett County. This is a thing that we know is existing. We look to programs like yours as inspiration for being able to have comprehensive systems that will actually allow us to have a childcare network. And I'm an advocate for an all of the above approach. What are, from your perspective or your suggestions, immediate steps like that we could take to be able to integrate a more systemic approach to childcare? It seems like funding is a piece of it. Like, I can't get away from the fact that in this conversation, the issue of funding is integral, but it also seems strategic as well. And so I just wanted to get your thoughts around those two interrelated issues.
Yeah, I think anytime you're I'm trying to think of how the best way. If we're talking from like a small, organic kind of advocacy perspective, anytime, and I'll speak for myself, that I am in a room, whether it's the Chamber of Commerce with the county commissioners, or it's like a networking lunch for other like nonprofits, whatever community it is, or whatever, kind of population I'm speaking with, or whether it's a group or one-on-one, like really either just directly asking them, like, what is your bottom line? Like, what is most important to you? And if they're like, I need reliable workers, I need my, like, home health. This is a perfect example. It's a nursing home. They provide 24 hours round the clock care, Tori's home. And most of his employees are parents, specifically women that are single mothers with children under 0 to 5. And he's like, I can't get anybody to consistently come to work because there's always a childcare issue, because kid's sick, the childcare place is closed, or, whatever it is. And I'm like, okay, great. So this is like, and he's like, and it essentially affects my bottom line because it's more expensive to bring in like on-call RNs to kind of fill those holes. And so I'm like, okay, yes, this is a bottom line issue for you. And so I think finding a way, so then it was like, okay, well, what does it look like? How can we help support you to create an on-site childcare system? So like if there's a house that's behind your facility, like, could you in theory buy that property, and like with not that much investment, we could help support that, turn that into a licensed home-based childcare, where you have a childcare provider there, and you have they have this many seats that they could offer in theory to the community, but like you're going to make sure that like a few of those are held for your employees. This can be a really tricky model because a lot of times people want to open their own family childcare homes. They don't want to necessarily, or can't afford to like have certain slots held. But again, it's like coming up with like a creative solution to helping a small business in theory be able to kind of meet that need. And a lot of times, and something that he came back to the conversation was like, they want to keep using their childcare. And so then we're like, well, have you thought about offering some sort of like childcare benefit? Like maybe this is like a younger person, and that like healthcare for them isn't as important to them as childcare, or maybe they don't want to like earmark a 401k at this point in time. Maybe they want to have the benefit of helping to cover the cost of childcare somehow. So I think that that's like an interesting component, is getting in the room with folks, finding out what their bottom line is, helping connect that back to childcare, and then also thinking through like just brainstorming, like, what could this look like for you? Like, and again, as I think you heard me talking about, like looking at bigger models and like, is this scalable down? Like people are always talking about scaling things up, and I'm always like, well, let's scale that down. What does that look like funded at like a quarter of the price with this only one staff member? What does this look like? And so I think that's something like in North Carolina, I'm not sure if it's a model elsewhere, but it's called TriShare. It's in North Carolina. They've now expanded it to all 100 counties. We haven't been able to implement it yet because again, it's that special thing of, because the model essentially is the child care cost is shared between the family, the employer, and the state. The rules around it are still very like stringent. It has to be licensed. I mean, the rules of kind of where the money can go to is pretty limited. And so we've been advocating for like more flexibility with those dollars, of course. But I've always said like, well, how do we make this work on a smaller scale? Because that was my feedback to the state. I was like, this isn't really going to work because we're mostly run by like small private businesses and small business owners. And like, nobody has, like, maybe the hospital could like potentially do something here, but like nobody else has the money to really come to the table for this TriShare model. But what could it look like elsewise? I don't know if that answered your question, Jeremy.
No, that last bit really resonates with me. There's some irony here. I'm right now. I'm at the Rural Summit. I'm meeting with funders who are, like ECMC and funders, and their big theme that I keep hearing is solve for one, extend to many. And to hear you say the opposite, to hear you say the exact words in the other direction,
that's so funny.
It's such a I don't know, meaningful kind
Yeah.
of connection for me to hear it that way. So all of that really makes a lot of sense to me. What I guess I think it's about having those conversations. I'm just reiterating what I'm hearing,
Yeah.
and really getting a sense of what the bottom line looks like, and then come up with creative solutions through conversation, especially when you're working with folks. Are there specific folks who you've worked with who were your allies to the strongest degree? Like when you were having these conversations, I heard a few folks, but could you talk to us a little bit more about building those alliances?
Yeah, I will say too that this all kind of before we really started, I think, especially with our FFN care. So our county created this early childhood collaborative, and it was called Get Set Transylvania. It's still functioning and still operating, and it is literally a cross sector initiative that brings together tons, and I swear to God, sometimes I'm like, I feel like every single entity in the county is involved in this. Everything from like first responders, early educators, health service, social service, like you name it, people are there in the room. And it really started because everyone's like, okay, we recognize that everything comes back to childcare and early childhood education and development. What can we do to help support? And so a lot of it was rooted in these monthly meetings where people were coming, talking about what their agencies and organizations were doing, what's going on. We would plan a couple of different meetings. This is also what we leveraged. This collaborative group, Get Set Transylvania, is what was leveraged in order to get us as one of the, the first rural Sesame Street and communities on the ground community partner. And that was in 2018. Sesame Street and Communities has since transitioned kind of their partnership model and how they function, I think, boots on the ground. But that was really kind of what attracted them to us, was that it was really this like a bunch of people. So it was everything, also then a lot of local childcare advocates, like people like I was saying that had moved to the community, that were retired teachers, recognized that there was a really big issue with childcare and just wanted to kind of be like, hey, we'll be in the room. What can we do to help, here? And so I think having that like organized coalition of folks together, and and Smart Start was the official agency for it. We still are, for the collaborative of Get Set Transylvania. And so we were able to fund, different community events. We do a family dinner series where we cover the cost of childcare as well as food, hosted at the library. We have guest speakers come in. We connect it back to a Sesame Street and Communities resource, and things like that. So I will say that, and it's those connections too that were forged in that collaboration that are still kind of nurturing what we're now doing today. So the Family Place, which, again, that's like a very specific type of agency. It's a nonprofit organization, but it's also like, I was saying it's kind of a community hub, if you will. Our local Parks and Rec department, the library for sure, as well as some folks that are in the social services, child protective services, things like that. So we kind of have those, again, it's like that. Oh, and then the faith-based community as well, because we have a lot of childcare with them. So I think just, kind of bringing everybody into the mix, and then the strongest kind of leaders rose to the top, if you will. And I will say that, and then definitely like our Chamber of Commerce, like really helping them recognize that this is like, whether they like it or not, something that is going to affect the local economy and business. And it's really fascinating because we tried to, with our Transylvania Economic Alliance, went to them a few years ago and we're like, hey, let's partner together. Let's have, let's do something that bridges the gap between the local economy, younger people, especially moving here. This was all started during COVID, when everybody and their mother seemingly was moving to the mountains. Everybody wanted to move to Appalachia and work remotely. And then they're like, oh, but there's no childcare. Great. But it was interesting because at that time, then they were like, actually, like, this isn't really what we need, And interestingly enough, within the last like 6 or 8 months, they have come back to us being like, no, this is like something that everybody's asking for now. And none of us know what to do about childcare, and like, what can we do? How can we support? What are y'all doing? What do we need to do? Just again, getting that kind of So sometimes it takes different groups, different timelines, I guess, if you will, to kind of get to there. But again, this isn't new news. Like everybody on the national level, as well as state and local levels, know that childcare is a really big issue, and that it's only getting more expensive and harder to find. And I think too, that's going to have like a need to also have some sort of reckoning with, and and I think that this is a hard one not to crack, even for us, like of how to get more, at the end of the day, respect for early childhood educators, specifically, especially those that go and pursue it in higher education, like that aren't necessarily only going to go up towards higher administration roles. And that's a system issue, and it will take time. I believe we'll get there, but it's going to take time.
So
I
where
did
does
see
the
your hand up,
conversation?
Frank. Sorry.
Oh,
Cut you off.
no, go ahead.
Oh, Frank just had his hand up. I just wanted to acknowledge that he did.
Yeah, I think I had this sound issue where I got a bounce going before. I'll state my quick question and ask Eileen to just give us a couple statistics on Transylvania County as compared to Garrett County. Population, size, any economic indicators, because what you put together is tremendous. I wonder if it's as transportable to maybe a county with less available. Anyway.
Yeah, no, that's a great point. In light of time, and also because I think these numbers are fascinating, if I can email those out after, because this is something I think when I initially spoke with Chris and Jeremy that came up, because again, I come from Garrett County, so I know what the landscape is, and I imagine it is somewhat similar in many ways. I'm just talking about like population demographics and whatnot. Like being here on the ground, it feels like home. It literally just feels like home, but with a North Carolina flag. And Transylvania County also, like a huge driver of a lot of our issues is the cost of living, affordable housing, right? So 75% of the actual land within the county is eaten up in a wonderful way by the National Forest. So by DuPont National Forest and by Pisgah National Forest. And then also that's a component of like, so we get this huge, because we are home to these things, it's the best mountain biking on the East Coast, or like east of the Mississippi. So we have huge numbers of tourists, like basically like destination tourism for camping, hiking, and mountain biking specifically, as well as kayaking is a huge one. And I know Garrett County has lots of these things. And so we have a huge, like, local, somewhat seasonal economy driven towards tourism. But then at the end of the day, tourism and then retirees are folks who are wanting to buy a second home. And a lot of these folks live in Atlanta, they live in Charlotte, similar to Garrett County, where people are coming from Baltimore, DC, or Pittsburgh, right? And so they are buying second homes, and they maybe are renting them, they're maybe not, or they're just retiring there, and they're not bringing in a family and investing and kind of recirculating their capital into the community the same way people that are raising a family are. And so it creates this really interesting division between, like, there are people that have lived in Transylvania County for generations and generations and have never left, and they love it. That's where they are. That's where their people are. So, but they have also never pursued any sort of secondary or higher education. It's a very, very blue collar, very, very like, not a lot of friends, parents that worked in the coal mines, but here it really is more like working at the airport, working all the gas stations, breweries, a lot of that manual like labor. And then you have that though juxtaposed with people that are buying multi-million-dollar pieces of property up on the side of a mountain and like only spending 6 months out of the year there. And so there is that, I think, similarity to, because I remember too, the feeling of like the Deep Creek Lake folks that would come every year, and it drove a ton, as well as WISP, it drove a ton of tourism and a ton of money, but at the same time, like it wasn't sustained and they weren't, kind of keeping their feet on the ground there. But I want to juxtapose, because I'm curious now a bit directly though, of like population, kind of the major driving economies, kind of maybe some of the biggest employers, because I'm curious about these numbers as well, and I would love to find them, and then I can shoot them back to Jeremy, and he can hopefully distill them out to y'all.
Sounds great.
All right.
You're on mute, Jeremy, if you want to say anything as we part. So a couple people have left and they said they want to be involved. So, we'll keep the conversation going forward. And if you, Eileen, are going to send out some information, that would be fabulous. Yep.
Yeah.
Thank you so much for your time today. And thank you
Yeah.
for everybody from Garrett County that's interested. This is, it's a good first step.
Yeah, absolutely. And I'm like catching up on the chat here about the trauma informed lens too. That's a lot of work that we do. We've done a lot of different professional developments and trainings within our own organization on that. So I'll take note of that. But yeah, I'll be in touch. Thank you all for taking the time. Appreciate you.
Thank you.
All
Thank
right.
you.
Take care.
Thank you so
Bye.
much.
Bye-bye.
Bye-bye.
Bye. Bye.